everybody, I am Julie Matheny. I am an IBCLC board certified lactation consultant and a speech pathologist with a background in pediatric feeding and swallowing disorders. Today I want to talk a little bit about weaning your toddler from breastfeeding. Weaning can be a gradual process that requires time, patience, and sensitivity. Do know that the World Health Organization and the American Academy of Pediatrics recommend exclusive breastfeeding for the first 6 months of life, followed by breastfeeding up until 2 years of age or as long as is mutually desired by you and your child. Meaning, breast milk never expires. Its nutrition never loses its value, and it's always a good, healthy source of nutrition for your baby at any age. Meaning you shouldn't feel pressure at the first birthday to wean unless you want to and are ready to wean. Your breast milk is always a good source of nutrition. But now let's say it's time for you to ready to wean. Let's talk about some strategies for weaning your toddler. The first is assess if you both are actually ready to wean. Look for signs that your toddler is ready to wean by being super distracted during feeding, not showing as much interest in breastfeeding, or showing that they're really just excited about foods and drinks. This may also come for you if you are starting to feel touched out, resentment at feeding, if you're ready to get your body back, or really any reason that you feel. This is you and your child. You get to decide when you are ready to wean. And it is a balancing act. Sometimes the toddler may be ready to wean, but you're still holding on. This may be your last baby. You're not quite ready. Or you might be really ready even if your toddler isn't. That is okay for you to have healthy boundaries with your child to teach them that I'm ready to be done, and that's okay too. Now we're going to talk about some steps to help you for weaning your toddler. One can look like introducing alternative milk or drink sources. If your child is 1 and you're ready to wean, the recommendation is to switch to whole cow's milk. Now, we as humans never need to drink whole cow's milk. It is a very good source of healthy fats, calcium, and vitamin D. There are other ways to be getting that calcium and fat in your child's diet. So if you have a well-balanced toddler diet, if your toddler is taking a variety of foods, you can introduce whole cow's milk or other milk alternatives. If they're eating a good wide variety, getting healthy fats, getting protein, calcium, vitamin D from other sources, you can also be switching to milk alternatives or water. And those are great discussions to have with your pediatrician or a registered dietitian if you have concerns about what you should be switching your toddler to. Next, you want to adjust your feeding schedule. You could gradually reduce those breastfeeding sessions, starting by dropping 1 feeding at a time. This can often be easier at the beginning of the day or in the middle of the day when you can distract your child. Overnight is a whole other ballgame, but gradually reducing the number of feedings can help you wean. The other strategy that you'll often hear is called don't offer, but don't refuse. Don't offer the breast at those routine times, but when starting the routine process, you could still offer the breast if your child is asking for it. Eventually, this will turn into distract, delay, and don't sit down. So when you're distracting, which is the next step, so you've not offered, you're not giving the breast at those routine times, you're waiting for your toddler to come to you to ask. When you're ready to shift that and make a change, now it comes into distraction and delay techniques. So engage your toddler in other activities. Maybe have a basket on the shelf of really preferred toys, those noisy toys that you really don't like but that your child loves. Those could come out when they're asking for the breast to distract them away from it. Or delay that time period. Say something like, oh, we're going to have our snack first and then we'll have our booby time. Or let's go to the park or on a walk first. Let's go wash our hands first. Let's go to the potty first. Trying to delay that time of that next feeding. And substitutions. Distract, delay into something more fun, an activity, coloring, a snack, something else to replace that breastfeeding. Another strategy that can help is gradually shortening the length of those feedings. It might look like starting a timer, singing a song, or reading a book, something very tangible that when that activity is done, so is nursing. So starting with a book, starting with a longer book, getting shorter and shorter books, singing a song, or the good old timer. You can start with the usual length of your nursing session, and across several nursing sessions or several days or weeks, you can gradually shorten that timer. When the timer dings, all done, until you're only going for a few seconds, and then it's all done. Another important strategy is discuss this with your toddler, especially older toddlers. 2 and 3-year-olds really do understand more than you think. Have a discussion about why you're ready to be done. They're a big boy or big girl now. You're ready to move on from other things. Maybe you're preparing for another baby. Have those discussions with your toddler. Pull them into this process. This is also a great time to start discussions of bodily autonomy. This is my body, this is your body, and we're asking consent for touching our bodies at certain times. There's ways that we can do this with age-appropriate language to help teach children about bodily consent and bodily autonomy. There are also books that help talk about this. One of my favorites is one called The Booby Moon. You can be reading these weaning books to help with this process, that this is a normal, good, and healthy process to go through. You can also, another strategy that can work is covering your nipples or reducing access to the breasts. This might look like wearing sports bras, high neck shirts, or dresses that reduce the access of being able to pull down and get to that breast. For older toddlers and preschoolers, sometimes covering the nipples with Band-Aids and saying mommy's nipples hurt or boobies are broken, whatever language you choose to use, can also help some children. You know your child best and what situation may work for them. We do also want to understand that there is an emotional component to this. So giving yourself full access to your toddler and your child emotionally can help with this process. And be kind to yourself. You may get into this and realize you're not quite ready, or that you're having more emotions about weaning than you expected to. That's a very normal process. When you're weaning and navigating how to wean from breastfeeding with your toddler, do be consistent and patient. Create a plan that you feel comfortable with and stick to it. Once you establish a rule about breastfeeding only happens in this chair, it only happens at this time of day, it only happens until the timer dings, do be consistent with that routine. If you're doing a lot of changing, especially because of tantrums, many toddlers are very smart and they will learn, mommy will give in if I tantrum or give pushback long enough. You've now given that power and control over to the toddler. So when you are done, be firm and stick to whatever guidelines you set. This can reduce frustration of expectation with your toddler. If they expect always to nurse at the same time of day and they don't get that, it can lead to frustration. So setting up the expectation and sticking with it can reduce frustration for both you and your toddler. Be patient with yourself. Know that this is a gradual process and eventually you'll get there. So that's the basic steps, some different techniques for weaning your toddler. Do be mindful that as you wean, some people can go through the weaning blues, which is for another video, not this one, and that night weaning and day weaning can work a little bit different. So those are the basic steps. Now you know. Happy weaning.